Welcome to Q4 Pod 2, Week 2, Lesson 1, Benefits, Part 1. What are the benefits? Well, Merriam-Webster Dictionary says benefit is 1, an act of kindness to benefit someone else. 2, something that promotes well-being. 3, financial help in time of sickness, old age, or unemployment. A payment or service provided for under an annuity, pension plan, or insurance policy, or a service as health insurance or a right as to take vacation time, provided by an employer in addition to wages or salary. And last, number 4, an entertainment or social event to raise funds for a person or cause. We are going to focus on numbers 2 and 3. Our lesson objectives today. The first is a central question that you should get out of this lesson. What benefits are available to you after graduation, up to age 21, or upon your 18th birthday? By the end of the lesson, you should be able to identify and compare organizations that are available to you, as well as identify benefits that you qualify for and can apply for now or in the future. The state standards are listed here to help you understand why this is a necessary part of your education. Some vocabulary that you need to know. Please write these words down. Benefits, Social Security disability benefits, medical assistance or Medicaid, insurance, Affordable Care Act, human resources, Planned Parenthood, and HIPAA. The first 3 will be covered in this lesson. The last few will be covered in Lesson 2. Let's do a little warm-up. Look at the graphic to the right. Do you or your parents use or access any of the benefits shown? For instance, health insurance, child care, community food bank or thrift store, think about ways in which you would use these different types of benefits that are available to you. Do you go to a gym? Do you have a little brother or sister or even a child in daycare? Do your parents own a home? Do they have someone who answers all their questions about financial planning for the future? These are things that we're going to be talking about based on your future. So pay attention. What benefits are for me? First of all, let's talk about what are benefits. Benefits are a payment or service provided by employers or federal, state, and local governments in time of sickness, old age, unemployment, or disability. Remember, previously we talked about what benefits were according to the Merriam-Webster Dictionary. Well, this here is a translated version specifically for you, which relates to our lesson. We're going to start off with federal government benefits. These are available to you through the federal government and are funded by our federal, state, and local government. And the first one is Social Security Administration. Underneath of that, you have Social Security disability insurance, as well as supplemental security insurance or income. Supplemental security income. The first one, Social Security Disability Insurance, pays benefits to you and certain members of your family if you are insured, meaning that you worked long enough and paid Social Security taxes. This one specifically relates to your parents or grandparents or possibly you someday. So after you retire, you collect your Social Security Disability Insurance benefits after you've earned enough time. But also, adult children may also qualify for benefits through their parents if he or she has a disability that started before age 22. Some of you may qualify for this because you have an IEP. So based on your disability, and if your parents are collecting Social Security, you may be able to benefit from their Social Security payments as well. The Supplemental Security Income Program pays benefits to disabled adults and children who have limited income and resources. This might apply to you too. At the bottom of our Moodle page under Q4P2, you'll see a resource section. There will be lots of additional information as well as websites, readings, and documentation to help you explore these further. To continue on, more federal state government benefits. The two other topics we're going to cover today are Medicaid and medical assistance, as well as MAUD and CHIP. The other 7 that you see here, ODP, OVR, CYF, MH/ID, CIL, and Job Corps, or the Pennsylvania Youth Leadership Network, will be covered further in Lesson 2. First, Medicaid/medical assistance. Medicaid is a federal state program designed to provide comprehensive and quality medical care for low-income families, with special emphasis on children, pregnant women, the elderly, the disabled, and parents with dependent children. In Pennsylvania, this process is known as medical assistance, but because it includes Medicaid as well as benefits that are not a part of Medicaid. Contacts are made through county offices, so everyone in the state has access to them depending on their county. The benefits to you: at age 18, you apply for Social Security benefits online, and then a disability advocate program worker will contact you from your county assistance office. Managed Care Special Needs Unit. 2 very important programs fall under this special needs unit. The first is MAUD, or Medical Assistance for Workers with Disabilities. Full Medicaid coverage is available to you if you are age 16 to 64 years old, you live in Pennsylvania and are a U.S. citizen, you meet Social Security criteria and are employed or self-employed, you meet income and resource criteria. They often have higher limits than Medicaid, which means more people qualify. And you can pay a monthly premium based on your income. The second program is CHIP. You may or may not have heard this. I've used it before in the past for my children when I was out of work. It is the Children's Health Insurance Program. CHIP provides free and low-cost coverage for uninsured children who are not eligible for Medicaid. It is strictly based on household income. For instance, my grandson was born a little over a year ago, and we signed him up for the CHIP program. But what happened was we didn't realize it. We thought we were signing him up for CHIP, and we were actually on the Medicaid page. And it turned out that he didn't qualify for CHIP, so they automatically put him in to the medical assistance program, because my daughter is under 18 when she had them, and she didn't have her own insurance. She had insurance through us. And as adults, we are not allowed to insure our grandchildren. And so since my daughter did not have a full-time job and couldn't insure her child, the state isn't currently covering his health insurance. So let's review the objectives. What benefits are available to you after you graduate from high school or up until age 21? So far you've learned about 3: medical assistance, Social Security, and the MAUD and CHIP programs. Tomorrow you'll learn about 7 more. By the end of lessons 1 and 2, you should be able to identify and compare organizations that are available to you. We're halfway there, as well as identify benefits that you qualify for and it can apply for now or in the future. So if you're currently 18 years old, you should be thinking about applying for some of these things. And again, check under the resources at the bottom of our Moodle page so you know how to do that. Some things for you to remember. All of these benefits in Lesson 1 and Lesson 2 and more are available to you after turning 18 or upon graduation up to age 21. You must apply for benefits. Watch this lesson as often as you need. And please, I hope you're taking notes. If you didn't take notes the first time, please go back and watch again and take some notes the second time before you move on to Lesson 2. And again, make sure you print those resources available to you on the Transition Moodle page. In our next lesson, Lesson 2, we will discuss the other benefits listed earlier that you could benefit from. They are ODP, the Office of Developmental Programs; OVR, the Office of Vocational Rehabilitation; CYF, Children, Youth, and Families; MHID, the Office of Mental Health and Intellectual Disabilities. That actually falls under ODP. That office falls under the Office of Developmental Programs. And CIL is the Center for Independent Living. And I also would like to touch briefly on Job Corps to remind you of the services that are available to you then, if you should have difficulty going to school or finding a job after high school and you think you'd like to check that opportunity out. And also, finally, the Pennsylvania Youth Leadership Network. That's it for Lesson 1. Please go back and review if you need to and take really good notes. Next stop, Lesson 2. Don't forget to answer the questions at the end of this lesson before moving on to Lesson 2. And then also make sure you have your notes ready when you're ready to start Lesson 2.